My Virtual Physician, David L. Howard, MD, PhD, CEO. My Virtual Physician brings specialist care to underserved rural and urban communities. We do this by leveraging the power of telemedicine and combining it with brick-and-mortar facilities. Our mission is to improve access to specialist care for underserved populations. My Virtual Physician's hybrid telemedicine clinics enable patients to get some of the benefits of coming to a brick-and-mortar facility while still benefiting from telemedicine. Because telemedicine does not require doctors to move to a rural area, telemedicine is a powerful tool to connect people in rural and underserved areas with specialists they would otherwise never have access to if they were to rely on seeing that specialist face-to-face in person. Our telemedicine clinics look like a full regular clinic. However, it only requires a medical assistant to be on site. The medical assistant can check vital signs and conduct various ancillary tests as well as administer vaccines or even draw blood if necessary. Then, for the doctor consultation portion of the visit, the patient sits at a consult station equipped with a screen and a webcam, and they can connect to our specialists as well as our primary care doctor if necessary. This is the beauty of a telemedicine clinic, and we believe this model is scalable and holds great promise in extending care to hard-to-reach areas. In healthcare deserts, 80% of the country lacks adequate access to healthcare. Medically underserved areas and populations are those designated by HRSA as having too few primary care providers, high infant mortality rates, high poverty levels, or a high elderly population. These areas may face challenges due to a shortage of doctors and healthcare providers, affordability and high poverty rates, limited health insurance coverage, geographic isolation, limited internet access, health literacy, and transportation. Only 45% of the national need for primary care is met. There are simply not enough physicians to meet our nation's growing healthcare needs. Demand for physicians is far outpacing supply. The struggle to hire and keep doctors in rural and urban areas means patients go without care. In primary care deserts, there is one provider for every 10,449 people. The first problem is recruitment and retainment. Trends indicate it is becoming more difficult to recruit and retain primary care physicians in underserved communities. The second problem is work hours and lifestyle. Physicians in non-underserved areas were more likely to cite work hours and lifestyle as reasons for selecting their current practice location or for leaving an underserved area. The third is medical education. Where people train, mostly in cities and big urban centers, tend to be where people practice. Specifically, only 1% of doctors in their final year of medical school say they want to live in communities under 10,000, and only 2% want to live in towns of 25,000 or fewer. According to an analysis by 24/7 Wall Street, every state in America, even states with a high doctor-to-patient ratio, has at least one county in which there is no doctor. My Virtual Physician's telemedicine clinic is a unique model that brings comprehensive and very specialized healthcare access to underserved urban and rural communities. We stand apart from other telemedicine providers in several key fundamental ways. Our telemedicine clinic solves the limitations in telemedicine. We address patient preference, hands-on physical exam, and technology obstacles. It offers some of the same services that you would expect from a traditional in-person doctor's visit while also providing the equipment to meet virtually with your doctor. We believe in healthcare equality for all. A certified medical assistant, or CMA, is on site and is able to bring back the human interaction and assistance of the patient, and the rest of the slide remains the same. The CMA can also take vital signs, draw blood or collect urine samples if required, and administer vaccines. Virtually meet with one of our board-certified physicians. We have private rooms available where telehealth equipment is set up for patients to virtually meet with our board-certified physicians and specialists. Patients will have access to a range of medical services, including general consultations and mental health services. What makes us different? Telemedicine clinics. Our telemedicine model means that the patient never has to rely on having a doctor physically in the clinic. Our own specialists. We employ or contract all our specialists directly, so our specialists belong to us. Price point. My Virtual Physician charges $49 for a 15-minute consultation, far lower than most competitors. And multi-specialty. We are a true multi-specialty telehealth company with specialties on staff that other telemedicine companies completely ignore, including chronic illnesses, obstetrics and gynecology, pediatrics, and wound care. Advantages of My Virtual Physician include obtaining vital signs. Our physical clinics enable a certified medical assistant to measure vital signs, conduct urine tests for infection, administer vaccines, and draw blood if needed. Affordability. We have the most affordable price structure in telemedicine. OBGYN. We cover the entire spectrum of obstetrics and gynecology consults. Women's healthcare. In addition to multiple OBGYNs, we have primary care, pediatrics, obstetrics, pain management, and endocrinology. And choice. Schedule a single online doctor appointment with any virtual physician or medical specialist of your choice. Why we're better and how we compare to other telemedicine options. We consistently cost less than most other virtual providers for 15-minute visits for patients without insurance. We are staffed with full-time specialists, unlike the majority of our competitors. We offer more comprehensive services than other virtual providers. We offer face-to-face video, and we accept Medicaid and Medicare. Teladoc does not employ OBGYNs and therefore has limited ability to execute true and comprehensive telegynecology visits. My virtual physician has numerous OBGYNs on staff. One Medical is primarily a primary care telehealth company that charges a membership fee. We're a true multi-specialty telehealth company with no membership fee. Finally, Doctor On Demand promotes nothing about women's health. Doctor On Demand has higher fees. Their visits start at $79 for a 15-minute consult, and we charge $49.99 for a 15-minute consult. NewRx has a narrow focus primarily on birth control. My virtual physician does the entire spectrum of gynecology consults. Their telehealth is also asynchronous. Lemonade Health is a telemedicine provider that does not accept insurance. This is a massive point of differentiation with my virtual physician. Maven has a narrow focus, primarily on fertility care. My virtual physician is a true multi-specialty company with primary care, OBGYNs, pediatrics, pain management specialty, and endocrinology. Dr. David Howard, MD, PhD, CEO, OBGYN, was originally born in Jamaica and immigrated to the U.S. at the age of 18. He received his Bachelor of Arts in Psychology from the Johns Hopkins University and then pursued his MD and PhD in Epidemiology through the Medical Scientist Training Program at the Johns Hopkins School of Medicine. He completed an internship at the New York Presbyterian Hospital, followed by a residency in obstetrics and gynecology at the University of Missouri-Kansas City. He also completed a postdoctoral fellowship in epidemiology at the University of North Carolina, Chapel Hill. He is currently a board-certified obstetrics gynecology specialist practicing in Las Vegas, Nevada, and is affiliated with several different hospitals in the area. Karen Lee, DO, COO. Dr. Lee is a board-certified obstetric and gynecology physician who loves to provide high-quality care evidence-based medicine to all women. She completed her residency at Beaumont Oakwood South Shore Medical Center in Michigan and also served in the U.S. Air Force, serving active duty members and family. During her downtime, Dr. Lee enjoys spending time with her family, cooking, and traveling. Doctors Howard and Lee are both U.S. Air Force veterans. They served the Langley Air Force Base simultaneously between 2015 and 16. Our team of board-certified doctors also includes the following physicians. Our team also includes Sarah S. Falcone, BSN, RN, WCNC, who is our nurse manager and has over 15 years of experience ranging from inpatient care to director of nursing roles and holds certifications in home health and wound care. We also have Stephanie Graham, RD, our registered dietitian. We accept the following insurance in Nevada: Anthem, Medicaid, Medicare, Molina Healthcare, and Prominence Health Plan. In other states, we accept Aetna, Medicaid, Medicare, TRICARE, and United Healthcare. See our website for more information about coverage areas. Our waiting room kiosk allows patients to check in electronically when they first walk in. The kiosk can beam in one of our remote administrative staff to talk to a patient face-to-face over video if the existing MA in the clinic is busy. This feature assists clinics in hard-to-staff areas who can now leverage the power of telehealth platforms. Only one medical assistant will physically need to be present in the clinic. All others, including physician and administrative staff, can work remotely thanks to the kiosk. In our private consultation room, patients can comfortably sit and talk with any one of our specialists. The benefit of blending traditional brick-and-mortar medicine with virtual medicine in our clinic is that we can still provide ancillary services that don't require a doctor to be present, but which need to be done in person. A patient in need of an ultrasound examination is a perfect example. An ultrasound cannot be done remotely. In our clinic, we have the necessary equipment available to give the most comprehensive care possible, in person and remote. We have successful B2B relationships with Kaya, Orchid, and Uresta. If you have questions, please reach out to My Virtual Physician. You can contact David L. Howard at 775-235-2894 and D. L. Howard at myvirtualphysician.com.